We have the wonderful Maureen Welker with us today. Thank you, Maureen, for joining us because we have some new information from the CDC, and that means some changes to campus. And I believe that an email went out to campus, but Maureen's here to give us some broad overview. And then if you have questions, unfortunately, because the website didn't stick, my pre-submitted question form never made it out to everybody. Promise, school ends in 6 days for my children. I will retain the brain cells I have, and I feel like a couple more might grow back as of like Thursday next week, but we'll see. Thanks everybody for your patience with me. If this is your first time, welcome. This is the HR Fireside Chat. My name is Casey Park, and this is your opportunity to meet with all of our wonderful HR representatives. And today we have a very fantastic special topic. We have our wonderful public health office, Maureen Welker, who's going to be here to talk to us today. And she threw a link into chat. Maureen, do you want me to share my screen and pull this up, or do you want to be able to share your screen? I can make you a co-host.
Why don't you go ahead and make me a co-host, but why don't you go ahead and share your screen for the moment?
Excellent. You are a co-host, and here we go. Going to share our screen. We're going to go on an adventure through the website. Excellent. Here we go.
Good afternoon, everybody. And thanks for allowing me the opportunity to connect with all of you. As many of you are probably aware, last week we did update our Boise State public health guidance to align with updated guidance from the federal CDC, state, local, and city of Boise, specifically regarding masking and the connection. I guess the new guidance that fully vaccinated individuals are no longer required to wear facial coverings. So that is a very large change that is impacting not only us here at Boise State, but locations all over Boise and all over our nation. As you can see, the guidance here, there are some places on campus that facial coverings will continue to be required both for vaccinated and unvaccinated individuals. And those places include the Children's Center, University Health Services, our COVID testing center and vaccination clinic, some specific connections around external entities that are using our facilities and still require their participants to wear facial coverings. A very good example of this is many of you may know that Boise State is in the process of hosting graduations for our Boise School District high schools this week. And as part of that, and because Boise School District still requires their students to be masked, those events will also continue to require masking. And then also on Bronco shuttles and other public transportation. The guidance that's on the page that I provided the link to goes into like associated details connected to fully vaccinated individuals around opening up around of physical distancing and where things are going in terms of classrooms, including for fall, talking about our continued cleaning protocols, and addresses questions, being able to question individuals regarding their vaccination status. I did also want to note that another page that is maybe not as, I've got to put this in the chat. as obvious that has been updated is our travel page. This is on our COVID pages as well, but this is specific to travel. This talks both about personal and then university sponsored travel. The personal travel has been updated, but it was updated a while ago, and by that probably less than a month, but things, are changing rapidly in terms of public health right now. So, and have been obviously for since this pandemic has begun. But in terms of personal travel, we refer individuals primarily to CDC guidance. There isn't any sort of requirement around personal travel in terms of the university. It's more of passing on guidance and recommendations that have been put out there by CDC, and is again, state, local, and our institutional groups are aligning with this. CDC continues to recommend delaying all travel until individuals are fully vaccinated. That just generally. The other piece here, though, is university-sponsored travel. At this point, all university-sponsored travel has to be approved by the appropriate divisional VP. This, we had sort of put a halt on all university sponsored travel and told individuals that they could reach out to their divisional VP for an exception. We've now moved to a situation where it's more of just requiring approval. The other piece is that the use of our university motor pool, those protocols have also changed. If you look, there's a link here to their web page, so you can look at that information as well. Scroll down a little bit more under announcement. Essentially, once again, fully vaccinated individuals can sort of return to pre-pandemic situations around use of the motor pool. But there's also the note that any individual at any time really, but specific to ahead of travel, can utilize Boise State's testing center to be able to have a clear vision of what their about what their COVID status is ahead of embarking on any travel, whether it be group travel, individual travel, and whatnot. So what I just wanted to do was point to folks to the locations where a lot of this information is. If you notice at the top of this page and in all of our COVID pages, we have this bright orange bar that directs people to this page. We did this because there's so many updates and so many pages and information that need to be adjusted as a result of these updates, that we wanted to have it all in one place while we were working to be able to update all of our individual COVID pages. Keep in mind, though, that our communications team is working diligently to make changes throughout our web pages. And the forecast is looking like by the end of the week, we will have updated, fully updated web pages around this new guidance. The other thing we get a lot of questions about ever since this guidance was put out is signage. So all over campus, there is public health signage. And what we did last week was to review our full grouping and listing or suite of public health signage to be able to understand which signage could remain, which signage needed to be updated, and which signage could be removed. That review has been completed, and the suite of our signage has been shared with, notes on which sign needs to be, how to handle each sign to facilities as well as to our auxiliaries. And they are all working diligently to be able to make signage changes, whether it be take things down, put things up, keep things in place, adjust, whatever. I would say that the one priority at this point is to have some signage in place around at the locations where facial coverings are still required by everyone on campus. So that is in terms of prioritizing new signage, that is what is being done. As the other thing I would say is the goal, even for facilities and auxiliaries, is hopefully by the end of the week to have the majority of signage adjusted. I absolutely cannot say all, because as you can imagine, there's a huge amount of signage all over campus. But I would say that after the end of the week, if you are noting signage that you feel needs to be removed or adjusted, please reach out either to facilities or to public health, and we will address that.
You have a minute for a couple questions that came in before we get into new content. So we did have a question, and I think this goes back to where facial coverings are still an expectation on campus. Do we have an idea of when the Child Center will not be requiring facial coverings?
There's no forecast for that at the moment.
Okay. And then Wendy had thrown in chat trying to understand how academic departments are supposed to get provost approval for sponsored travel. A lot of faculty, I think there will be a lot for faculty now that it's not suspended. How do we go about this? Do we have a process in place as of right now?
Yeah, and so, I mean, at this point, we've just communicated the change, but Wendy, I can go ahead and reach out to the provost office and pass on direction to this group.
Perfect. Thank you so much. A couple other questions. Michael, motor pool would be available to fully vaccinated folks. What about transporting groups in which some are fully vaccinated, some are not? That is a possibility. I love the question, Michael.
So we are navigating a very challenging situation in terms of, it not being clear as to individual statuses, and also, it's not clear as to the comfort level. And so this is not going to be an easy across the board answer. It may be something that needs to be navigated on an individual basis. But the way that we're moving forward is that in terms of use of those services, we are not requiring testing ahead of time. So then it becomes a discussion of whether or not a group of individuals wants to pursue that piece. It may be that options are given to folks in terms of transport, so that there's an option of using university vehicles and or personal vehicles. Again, a lot of this is going to have to happen on a one-on-one situation, conversation. It's going to be challenging.
I appreciate that. Michael, let me know if you have a follow-up on that. We also do have the question, and real quick from Wendy, can we adjust conference room occupancy, I can say words, guidelines back to full or within 3 feet spacing?
Yeah, so in terms, I think that as we look at conference room occupancy pieces, a lot of this is connected to return to work policies just in general, which is something that is being vetted at the VP and exec level. I know that there are discussions around being able to move forward with adjustments around communications around return to work early in the month of June. And so getting into the details of conference room spacing and who can return to work and in which capacity, if remote or hybrid offerings are going to be available to individuals, this is all still coming.
Yeah, okay. Thank you for that. So more to come, Wendy. Sorry. Okay.
So in terms of, in the absence of additional guidance, I would just say it's still status quo.
Okay. So we do have, real quick, before we get to Christy's question, I've got a couple anonymous questions that all kind of lead to the same question. What about the honor system? Are we using the honor system? There's no passport that we're doing. And what about departments where you have people in the office without facial coverings and you personally know that they're not vaccinated or whatnot? You can't ask people if they're vaccinated. That's a HIPAA thing, and it is the honor system. And honestly, it's positive intent at this point in time. We don't want to assume that people are doing things negatively. Would you like to add more to that, Maureen, from the public health side? If people have questions, we're asking they be sent to hrgrowth@boisestate.edu, and HR and public health will work with through concerns. But from the public health side of things, do you want to?
You bet. I think there's a couple things I just want to raise, probably that will address a number of issues and concerns. One thing I'd like to remind folks that we all need to recognize that an individual's decision to mask and or physically distance themselves from others may not be a reflection of vaccination status. This also very much is connected to personal risk perceptions and personal choice. So I think we need to be very careful in our interactions and dealings with others that we're not making an assumption one way or the other based on how individuals are behaving around masking and physical distancing, that is a true reflection on their vaccination status. I think the other thing I want to point out is that we are entering a world where that respectful workplace training that we've all had could not be any more relevant and any more important. A respect for one another is one of our university's shared values. And we have to remember that, we are committed as a university to diversity and to inclusivity, and that we need to make sure that we are including all members of our campus community and valuing them regardless of their vaccination status or of their public health risk perceptions, or even of whether or not they're masking or unmasking. And respect is going to be sort of the key word, I believe. And here I'm not even an HR person, but in terms of movement forward. So I guess those are just a couple of things I wanted to pass on.
I appreciate that, Maureen. I mean, yeah, it's not cut and dry.
It is not cut and dry. The other thing, I did also want to speak just in terms of our new public health guidance. I know that some individuals have reached out to us to say, we've gotten comments of folks saying that we're discriminating against people because we're requiring unvaccinated people to be masked. And in some cases, they're saying, well, everybody else has lifted these requirements. That's not the case. So keep in mind that we aligned our guidance with CDC, state, and city guidance, all of which their language is either require or recommend that unvaccinated individuals continue to wear facial coverings and practice physical distancing. Our Boise State language is strongly encouraged. But I can pass on to anyone who wants to be able to see this language, but it does all still exist, that it is a requirement and a recommendation at all of those levels. So just wanting to pass that information on as well.
Thank you so much. Okay, I think Christy had one thing for us, but it was a bit of a statement. For those traveling outside of the U.S. territory, make sure you visit risk management. Report your foreign travel no less than 30 days before travel. I love that we have departmental plugs. She's got a link in there for you to check it out. And I'm sorry, I'm scrolling through chat because we've got we had one more on the university sponsored travel. And this one was less on the academic side. When we do get new COVID travel policies, those will be given directly to departments, correct, Maureen?
Well, I know too that we're hoping to be able to do some update articles as well. So even this new guidance and as well as like the travel pieces is going to be communicated again in some update articles. So stay tuned with that. And we continue to do the best we can in terms of communicating out as quickly as possible.
Perfect. Okay, I think that's all the private chats I've gotten. Okay, I wanted to just like get through them real quick while I had a second. Thank you for your patience and your guidance, Maureen.
Yeah, I just had one other thing. Sure. Yeah, I just had one other thing that I thought might be useful to share. And for this, I may need to do a screen share, and I apologize because it's larger than a typical screen here, but let's see here. I wanted to share with folks some results that we have from our recent COVID-19 vaccine and sort of we title it sort of reintegration assessment, but it's kind of like personal risk perceptions associated with vaccination. And so we do have results from this. Keep in mind, again, we're in a constantly fluid situation with COVID-19. So this is April when this survey was conducted. But as you can see from this, so this is the results of this survey specific to employees. And by employees, this incorporates both faculty and staff across the university. So our response rate, again, this was an all-campus survey, and our response rate among employees was 46%. Of the respondents, 84% had received at least one dose of a COVID-19 vaccine. Of those who had not received an initial dose, so 16%, 40% were still interested in getting vaccine, and 64% of those did have a vaccine preference, and you can see the preference there. 35% of all respondents were concerned about side effects. 78% felt that educated about COVID vaccine. You can see, I might be pretty tiny, I apologize. Trusted sources for vaccine information was the CDC, healthcare providers, Idaho's Central District Health Department, Boise State, the state of Idaho, and then family and friends. This is an order of rating. And you can see why respondents reported why they were not interested in getting COVID-19 vaccine. So those who said that they were not interested, these were some of the reasons why. This bottom aspect, keep in mind, this was April and things have changed, but once fully vaccinated, 73% thought that physical distancing would remain important, and 75% felt that mask wearing would still be important. Factors affecting willingness to be on Boise State campus indoors for all respondents. Being fully vaccinated was the highest at 84%. So that's the individual themselves. Then having the majority of the campus being vaccinated, that was 85%. Having current physical distancing protocols maintained, 83. Health and hygiene protocols maintained, 79%. Mask protocols, 72. And cleaning protocols, 71. Many folks are especially interested in knowing that number of percent of individuals that have had at least one dose of COVID vaccine. So again, this was specific to the employees that responded to this survey. Just to note, when we pulled faculty responses only, we were looking at 90%. The overall for our full campus community members that participated in this survey, 67%. And for students specifically, 56%. So that gives folks, I guess, a sense of where we are in terms of vaccination numbers. And again, this was April. And it's not everybody, it's the folks that responded to the survey, but it does give us a picture.
Yeah. And you might have said this, but I've been monitoring chat. Is there going to be a follow-up to that coming up this summer, or to collect more data?
And are you saying a follow-up survey?
Yeah.
I don't know if there isn't one currently planned, but it's something that we will be looking at.
Perfect. Okay. I did get another question, and I'm also I'm low-key curious about this one. So if I am vaccinated, but my kiddos aren't, if I go into stores unmasked, is there still a chance that I can like get it somehow and then give it to my little ones?
So, there's no 100% black and white, but the studies that are out there currently are pointing to the vaccine's ability not only to protect the individual themselves, but to prevent transmissibility, or the ability of the person who has been vaccinated from being able to pass something on to somebody else. Again, these are early studies, but the studies and the research being done currently is pointing to very positive results in that direction.
That's super cool. That makes me feel a lot better about having walked into Fred Meyer without a mask yesterday. Whoops. Okay. That's all I have in chat at this moment. Do you have new content for us, or do we want to turn it over to the audience for some ad hoc questions that they might have and on mic, or throw more things in chat?
Yes, that was all I had from my side, but I'm more than willing to answer any questions either through chat or directly.
All right, you heard her. Attack. I mean, be nice. She's our guest. We want her to come back and tell us always the new things that are happening. Have you heard anything about an annual booster? Ooh, Stephanie. Yeah, good question.
Yeah, early, always time is so so odd in terms of how, especially since things are moving so quickly. But months ago there was definitely information in the news coming out of Pfizer around there being boosters available in the fall, Pfizer boosters. And, I really haven't heard much more about that. It is definitely still on the table, but I feel like they're still evaluating the need for those boosters. And I haven't really heard any updates either around Moderna or around J&J. I've heard more around adjustments around the length of effectiveness around those vaccines and less connected with movement towards boosters. That's not to say that boosters aren't in the forecast, but they're just, there hasn't been a lot communicated about that right now. And that could also be, you know, especially Pfizer has got, well, all of these vaccine manufacturers have a lot on their plate in terms of moving away from emergency use authorization and working towards full authorization from the FDA. And then there's also a huge push, obviously, has been Pfizer to be able to get emergency use authorization for their vaccine for 12 to 17-year-olds, or sorry, 12 to 15-year-olds, and now Moderna for 12 to 17-year-olds, because their vaccine never went down as low as age 16. And then there's also both Pfizer and Moderna are in the midst of doing studies with children even younger. So as young as 6 months children as young as 6 months are in studies connected with both Pfizer and Moderna.
Excellent. This is all fascinating. Wendy, what do you got for us? Do you want to
Yes. Hi. My third question of the day, so typical. I just was working with my group on being an input person and how that makes me ask a lot of questions. So thank you.
I love it. Input number one.
Yep. I was just curious, Maureen, you'd mentioned that we can utilize the testing center. I just wondered, for personal travel, I know there are some states that require you to have a negative test, and I wanted to ensure, is our testing center meet the requirements of the certain type of tests that are required? And secondly, are we welcome to bring in our children to get a negative test for personal travel if we need that?
So I'll address the children first. Yes, you absolutely can bring in children. I would also note, and this is something that has been utilized by our Children's Center. We have actually developed some testing kits for children. So we've had parents go and pick up these kits so that you don't even have to bring your child in. You know, for some, and especially for the youngers, that is a pretty traumatizing experience, or could be. And being able to do it in the comfort of your home is definitely an option. So if that is something of interest, I would recommend just reaching out to our testing center to be able to get one of those kits. I know too that, you know, in terms of options for children, the fact that we do saliva-based testing, once again, significantly decreases the trauma connected to testing for children. So just something to pass on with that as well. Okay. In terms of
she just asked the question, and I was curious too. Are those kits the nose or the spit?
Spit.
Okay, because I was like, I already have to.
We're not going to make anybody.
Yeah, parents like, they already don't like us as it is. We're gonna jab something up their nose. I can say that because I took my girls in for a spit test, and that was definitely traumatizing for me as a mom. I'm like, oh no, we're encouraging them to do this? Gross. Okay. But the staff there made it so much fun for them. And if you have goofy kids like mine, if you're more comfortable with the at-home test, do that, because you won't gag in front of a Boise State employee. But also know that the staff at the testing center are super supportive and know exactly what to do to get your kid to spit into that cup. Ugh, gross. So flashbacks.
There's also an aspect that for some children, it's not there. It works better just to do a swab of the inside of their cheek. And again, that's something that that the testing center either can do themselves or instruct parents on completing. So just know that is absolutely an option for
That is awesome. And thank you. But the second part of my question, is it the right kind of test? Like I'm traveling to Hawaii. I know there's people looking at international travel. They require a certain type of test. Is this the correct type?
So the issue is not so much, well, in terms of type, it's oftentimes it's PCR, but the issue is not necessarily always type, but location. So some states, including Hawaii and Hawaii specifically, require that testing only occur at certain locations. So we are not one of the approved testing facilities for the state of Hawaii. And that is not necessarily like a reflection on our testing. It's just the state has like designated certain groups that they that can do those tests, and it's a very small number. So what I would recommend is if you are traveling to a certain location that is requiring any sort of testing, do your research ahead of time. So the state of Idaho does have a great amount of detail in terms of how and where and when testing has to occur. But also, if you have any questions, just reach out to public health and we can help you navigate a lot of that too.
I love that.
Thank you so much.
Mm-hmm.
Megan asked the question about the turnaround time, and I answered in chat, how fast is the turnaround time? And I'm like, it was fast. I got my results for me and my kids the same day. And I've had colleagues that have gotten it within a day.
Yeah. And so, I mean, I think we typically communicate 2 to 3 business days, only because in some situations we'll have like an inconclusive result and we'll have to rerun a test, or maybe and there's also an aspect that in some cases we either are running too many or too little tests, so that alters our like turnaround time. But yes, we very often are able to have testing results within the same day, especially if the testing happens before noon.
Perfect. So get in before noon. Get a morning spit test in. Oh my gosh. Real quick, I want to back up just a little bit because Michelle asked forever ago if we were going to keep updating the COVID dashboard. I'm going to throw that link in chat right now. Is that going to continue to be updated?
It is.
Perfect.
Yep, we continue to update that. We've added things to that dashboard as the year has progressed, the academic year. We started with just providing information about positive cases. Then we started adding information about testing, then about positivity rates associated with our testing on campus. And now we've added information about numbers of vaccines administered. And very soon, in the next week or so, we are going to be breaking down that vaccination information to be able to share with campus community members the numbers of each vaccine that we're administering. So we'll break down those overall vaccine numbers by Moderna, Pfizer, and Johnson & Johnson.
That's so exciting. I'm so glad that the dashboard's going to stay moving. We had some comments and some great tips about international travel in there. Basically, be careful, read the fine print, because there are fees. That's crazy, but also super important. Do we have any other hands in the air? I don't, and if I missed something in chat, re-ping me. Gosh, you guys are quiet. Is it because y'all are eating lunch? Is that why we have so many people all quiet today? And thank you everybody for coming to a noon session. Julie, I love the thumbs up. Thanks, lady. Okay, I don't want to hold up any more time. Maureen, do you have any final words for us? I'll get there, Stephanie, I promise.
I guess I would just note that if I missed anybody's questions, please reach out to me directly and or to Public Health at publichealth@boisestate.edu. I appreciate everybody's patience as we, again, navigate this ever-changing world of COVID and are working to get all of our web pages and signage adjusted, and probably will continue to be faced with this as guidance continues to change. And then as, I guess, yet another reminder in terms of movement forward and in our work and our work environment on campus, respect number one. So keep in mind that shared value as well as all of them, and a pleasure to be with all of you again today.
Yes, and I loved Joanne's comment. Her presentation was thorough, and it did eliminate a lot of questions. So Maureen, I just absolutely want to thank you from myself and everybody else on this call, and everybody who's going to get a recap email, for all of your amazing insight and keeping us up to date in this wildly shifting world. So next week, with any luck, we will have Mark joining the Fireside to talk about our budget in the CEC. Poor guy has had the hardest couple of weeks, and we're just understand that it was nothing against you guys. Just poor Mark had some stuff he had to take care of. He will be here on the 1st. As of right now, I'm planning to be out on June 8th. So we're going to not have a Fireside that week, and we'll be back mid-June. Hopefully, I've got to talk to a couple people on campus because I've got some new stuff coming up. I want to give an update on the Headspace app that was approved and went through legal, and now I am officially working with Headspace. Bye, Maureen, thank you, to implement that. And you will be receiving more information about the Headspace app and how you can download it on your phone within the next 2 weeks, because I just got an email that says, hey, let's talk about implementation. So hold tight. We'll get some mindfulness and some good habit building over our summer, some rest, relaxation, and then we'll hit the ground running hard in August for our incoming students, and hopefully be back a little bit more in person to have this community building. But don't fear. We'll continue to have the Firesides, probably continuing over Zoom, because I made a point to Sean early on. I was like, it would take the lookout room to host this many people on campus, and the audio in there is not spectacular, and it's cold. It's cold. I'd rather y'all be able to sit in your comfort of your own places with some tea and enjoy the Fireside. So we'll keep that we'll keep going for that for sure. Yes, the lookout room was fun for other things, Wendy. I won't bash on the lookout room. Plus, I love our event services people and all that they do for campus. Okay, I'm gonna give you some time back on your Tuesday. Normal time next week. Remember, we do not record Mark's sessions, so you have to be in person. Have people send me emails if they wanna be added to the invite, or there is a sign up on the website. I double checked, it did update this time. Yep, life is good. Everybody have a great week. Bye.